Well, with swimsuit season just a few months away, people are already trying to get ready to hit the pool or the beach. And if your healthy eating habits and your workouts just aren't cutting it, well, there's another option to get you looking fabulous in just a few months. Dr. Tina Alster is the founding director of the Washington Institute of Dermatologic Laser Surgery. She's here today to talk about some non-invasive treatments for fat reduction that can help us tone and shape, and we love the sound of that. Good to see you again, Dr. Alster.
Thank you for having me.
So like we said, you know, some people diet all the time and they exercise all the time and just not seeing the results. And this might be an option for some people like that need a little extra.
It's true, and this is the time of year when people come in thinking about bikini season. For me, it would be a one-piece season or a sarong season, but I have a lot of people who are worried about what their body's going to look like in more scantily clad attire. So I have a lot of people who have been exercising all winter. They kind of reach a steady state. They're in good shape, but they just want to get that extra little oomph to make their body look more toned.
All right, so we're talking about something that requires no surgery. We're not doing any anesthesia here. We're not cutting or sewing up. And so the first one is something new, right? It's called Liposonix.
The Liposonix is brand new. In fact, I have the only system in the Washington, D.C. metropolitan area, and one of the few in the U.S. actually. And this is using highly intense focused ultrasound to target the fat deep in the dermis, which is the deeper layer of skin, and it actually destroys the fat in that area, allowing your body to naturally clear away the fat. So it's non-invasive. We mark the area.
Are we looking at the machine right now?
We're looking at it right now, exactly. And what you're using is an ultrasonic device. We always think of using ultrasound to image babies in utero. And certainly that's using lower in energy, unfocused ultrasound. This is high intensity. So people will feel this during the treatment. It feels very hot. And in fact, it can pinch a little bit. So we do give a little painkiller to people, but people can walk in and walk out after the treatment, and you'll start noticing improvement in the area in about a month, but the full effect takes a few months. Basically, if you can pinch an inch, you'll lose an inch after a single treatment. So it's really effective for the abdomen and the flanks, the love handles.
Love handles, okay.
That's right.
So those are the two areas, only two areas where you're using it right now?
That's correct. You really need to have enough fat that you can pinch it, but not so much that you can grab a whole handful. That's what we use something else for, called Cool Sculpting.
Now, is this just a one treatment thing?
Yes, this is primarily a one treatment thing. You can repeat it, but I would wait 3 to 6 months to get the full effect from the previous treatment. But most everybody will lose an inch. If you want further body contouring, it can be redone if you still have an inch that you can pinch.
So those are real trouble spots, you know, little tummy bulge.
I don't know anybody
handles,
over the age of 40 that doesn't have at least an inch. And so
even
this
if
is
you're
nice.
a thin person, sometimes that could be a trouble spot right there.
It's hard to target those areas. I think even if you exercise all day long, it's hard to get rid of those little problem areas. There's nothing that gets rid of it like this.
So other than this heating up, that's the only sensation you would have? There's no pain involved afterward?
No, afterwards, the worst that can happen is you can have some bruising. You can look bruised and feel bruised for about a week or two. That occurs in about 50% of the patients. The rest of the time, there's really nothing. Most people don't feel like doing 100 sit-ups right afterwards. In fact, they feel like they've done 100 sit-ups after they've had the treatment. So it's a little sore, but it doesn't prevent people from going back to their work or other regular activities.
All right, now you mentioned the next one called Cool Sculpting.
Right.
Who is this recommended for?
Well, the Cool Sculpting uses a device that goes through the outer layer of skin and freezes the fat cells. It's a slow freeze. And this is for people who have a handful of fat that you can grab, not just pinching an inch. A full amount of fat in the abdomen, again, love handles. We're sometimes able to use it depending on how much fat somebody has on the lateral upper thighs, but this actually gets clamped onto the skin, as you see here in the video, and people stay attached to this cooling device for a good hour. It's a slow freeze, and if you do it too fast, you end up freezing the outer layer skin, but that's not what you want. That's why it has to be slow. And you can see right here before and after photographs of the skin after a single treatment. Now, it's not really used as a treatment for cellulite. You can see improvement of cellulite, but that's not really what it's for. It's really for reducing a large amount of fat in a discrete area.
So the science behind this, I mean, it's you're freezing the fat cells.
Right, it's
to kill
looking at
them?
it. It's looking at totally from the opposite direction. We've been trying to use lasers and ultrasound and radio
heat.
frequency devices to heat the fat. But actually, fat cells are much more sensitive to cooling. And so some bright person decided, oh, let's freeze the cell. How can we get the freezing down that far? And that was the hard thing, is doing it slow. And so the Cool Sculpting device does just that.
Interesting. Very, very. I didn't even know such a thing existed.
Yeah, exactly.
So cost-wise, the first one, the Liposonix versus the Cool Sculpting.
The Liposonix will run about $2,000 to $2,500, depending on if you're doing one area or two. Similarly, for the Cool Sculpting, it tends to be about $1,000 per area, and each area that you do takes an hour to treat. And that's true with the Liposonix as well. They're just totally different machines, looking at from two totally different ways.
Okay. Now there's a third method here of
That's
reducing
right.
the fat cells, and it's called BellaContour. Tell us about this one.
Well, the difference between BellaContour and the other two devices, the Liposonix and the Cool Sculpting, is that this is a series of treatments. You don't just do it one time. It's an easy 45-minute treatment where you use a low amount of ultrasound, once again like the Liposonix, but just a low energy along with electrical stimulation and a little bit of manual pressure. And this actually recontours the skin. Now, this is good for people who have diffuse deposits of skin, not an inch, not a handful, but more diffuse if they just want to look better. You know how people have a little bit of rippling in the skin? And as you see here, it improves slowly the area, and it doesn't hurt at all. So we have three different things for mild, moderate, and severe fat deposits.
Yeah, and you need more than one treatment with this?
Yes, you do need a series of treatments with this, usually about 5, and it can be done every other day. So within 2 weeks, a week and a half, you will have a series of BellaContours. And again, it takes about a month, up to 3 months to see the final result from the series of treatment.
So it's good to know about all these treatments, but ultimately as a patient you come in and you say, doctor, I would like to reduce here, and then you as the doctor would recommend which procedure they would
That's very
get.
true, and it's even confusing for me sometimes. We have all these different devices and trying to fit them into the right type of patient. But like I say, we do mild, medium, and severe, and none of them require cutting or anesthesia.
And that's the best part of all,
Absolutely,
isn't it?
yes.
Dr. Tina Alster, thanks so much for coming in today.
Thank you so
Always
much for
interesting
having
to
me.
have you. Well, getting organized this tax season takes a little bit of work, but we've got some tips to help you prepare. And if you want some more, you can always follow us on Twitter.